kind of a personal introspection here. We know that this valley is rich. There's a lot of money flowing through this valley, but sometimes it's not readily apparent. Sometimes it can be something as simple as having a roof over your head, food on the table, and a warm place to sleep at night. That's when you know you're rich. So oftentimes you can drive through here, drive into Santana Row, and you see the tents pitched underneath the bridge. I don't know about you, but it affects me, and it makes me think how lucky I am to have a roof over my head, a warm place to sleep, and food on the table. But it's not only just on your way to Santana Row, it's here locally. And so to bring that to light, David is going to talk about a crisis without a home and tell us a little bit more about our homeless situation. So without further ado, a warm welcome for David.
Thank you very much. It's indeed an honor and a pleasure to be here for many reasons. First, I'm a Rotarian. I've been a Rotarian for 18 years in the Afternoon Club. One of the first reasons I joined Rotary was my board of directors made me. But actually what I found out was it was a great avenue for me, even though I work for a nonprofit, and serving those that are less fortunate is something that I've done throughout my entire career. Rotary gives me a vehicle to do more. I don't want to default and say, I work for a nonprofit, I do enough. So everything that I'm about is kind of what Rotary's about, service to others, right? So anyway, I'm loving this club. It feels energetic, it feels vibrant, and it's a pleasure to visit you tonight. So I'll jump right into it. I brought some light reading for you. We can't avoid, in the past few years, I'm going to say a handful of years, without the topic of housing and homelessness peeking up everywhere we look. It's on the news, it's in the papers, it's a topic of conversation, and it is starting to be a crisis that is affecting all of us. Much like a disease, much like polio, there's really only about 1 degree of separation now between most people and knowing somebody who's homeless, knowing somebody who's at risk of being homeless, maybe even somebody who was formerly homeless. But as Mark mentioned, you guys, we live in one of the most affluent and fortunate, the technology and the wealth and the innovation and all this that exists in our communities here is unlike anything in the world. Yet we have one of the highest populations of poverty and one of the highest populations of homelessness. And for me, that just doesn't seem right. There seems to be a huge disconnect with that. I'm not an expert, but I did want to talk a little bit about what's going on in our communities, how my particular agency is getting involved in that, and then also talk to you and certainly open it up for dialogue and questions if you have some. But what I find interesting is I was talking to a very good friend of mine. She is the Chief Executive Officer of Destination Home. Destination Home is an agency that was created actually through the efforts of Don Gage, one of our supervisors a few years back, to start dealing with the issue of homelessness. And Jennifer Loving is the CEO of Destination Home. And she shared with me not too long ago, there is not one community in the entire United States now where a minimum wage job is enough to keep you self-sufficient. And when I grew up, a minimum wage job did that. You could get by. You could find housing. You could put food on the table. You could actually access the basic, I call them not privileges, I call it a right. You have a right to shelter, you have a right to housing, you have a right to food, you have a right to live healthy. But that doesn't exist in our communities anymore, and it is certainly magnified here in Silicon Valley. So one of the things that we know about our community here is whenever a community accepts federal dollars to, let's say, deal with the issue of homelessness, HUD, the Department of Housing and Urban Development, mandates that those communities try to do a census. And based on that census, often will dictate how much those communities might receive in federal funding for various housing programs. So every 2 years, our community here in Gilroy, often spearheaded by St. Joseph's Family Center, the Gilroy Compassion Center, and literally a legion of volunteers, wake up at 4 o'clock in the morning for 2 days in a row and literally try to canvass this vast community of South County and try to give us an accurate census or count of those that are homeless. And since we've been doing this in 2003, time and time again what we see is, one, unfortunately the numbers are going up except for a couple recent years, but also a vast percentage. There's 18% of the homeless in Santa Clara County are actually in District 1, Supervisor Wasserman's area. Yet we only have about 7 or 8% of the population. So per capita, we have one of the highest rates of homelessness in the country, okay? My good friend Mark Turner, who is our club president for the Afternoon Club, has taken on an initiative. And he's trying to rally other clubs and other civic groups and other like-minded people, because I think communities for the longest time have said, homelessness, it's an issue, nobody likes talking about it, it's uncomfortable, people feel uncomfortable around the homeless. But that's the police's issue, that's the city of Gilroy's issue, that's the nonprofit's issue. No, it's our community's issue. And the only way we're going to impact and make a difference is if we bring together the community. And again, Susan used a great example about polio and how Rotary spearheaded that. But this is an issue that is going to take this community and every facet and every corner and every person in this community if we are truly going to make an impact. We can't thrust this off on the nonprofits. We can't thrust this off on the city of Gilroy or the police and say, this is your issue. Santa Clara County, over the last 5 years, and there was a really nice report done called Home Not Found that did some really in-depth analysis. The cost of a homeless person on the street here in Santa Clara County costs our community around $80,000 a year. The cost to house that person and provide supportive services is around $30,000. So $500 million was spent last year in Santa Clara County. And when I call serving the homeless or dealing with the homeless issues, about $300 million of that was health care. That's people on the street, frequent flyers, the chronically homeless, those that have the most disabling conditions are going to the hospitals. They're having EMT called constantly. The police are being called constantly. So of the $500 million, we're spending about 85 or 90% of those dollars just trying to care for those folks or remove them. A lot of that cost is actually jail time and the police time that it's cost to respond to all the calls they're getting. If you talk to Chief Smithy, the #1 call that they're probably getting nowadays is, I would say, the nuisance or the issue of homelessness. Now, these aren't violent crimes, my friends. These are people that are panhandling. These are people that are parking illegally, et cetera, et cetera. These are not violent crimes, but they are occupying probably, I'm not going to quote, but a vast majority, a lot of the calls that the Gilroy Police Department is getting on an annual basis. If we could reduce that and pull that money that is being spent on that and figure out a way we can channel this into services or housing for the homeless, then we're starting to look at solving some of these issues. So we recently did this study that just came out. It was just released. It's the homeless census in 2019. And what was really sad was, like I said, the county's been doing this. It's been mandated to do this since 2003. In 2015 and in 2017, we actually saw an overall decrease in homelessness. But in the last 5 or 6 years, there's been a huge spike in the cost of living and in housing. And so there was, according to this census, and again, it's one study, it certainly has some statistical variance in it, but there was a 30% increase in our county in homelessness in a 2-year period of time. 30%. These are not the homeless that have been homeless for a long time, have been counted. These are newly homeless. These are people that are at risk and are falling through the cracks and are becoming homeless. So one of the efforts that my agency, St. Joseph's Family Center, has really rallied around, along with some of our partner agencies, is a prevention approach. Much like healthcare, right? It's much easier to deal with the health problem in a preventive way than dealing with it after the person gets sick, right? So the same thing with us. We banded together with another 7 different agencies for a homeless prevention program that was sponsored by the County of Santa Clara. We channeled a lot of time and energy into it, and over the course of our 2-year pilot, which was just recently refunded, we helped prevent homelessness in over 700 families with less than I think it was a 6% recidivism rate. So we feel, thank you. But homeless prevention and shelter and permanent housing, which is a key component to, again, alleviating the issue of homelessness, it's an entire package. We can't just approach it from one way. There's kind of a progression of services that we need to band together and form and support in order, like I said, to really make an impact in our communities. So I can go on and on. I can share some more statistics with you if you want. Or we can just open it up for some friendly dialogue and questions if you'd like. Gina.
So what, I don't know if you said this already, but first of all, I wanted to hear more of what is the solutions or what ideas are you coming up with to figure this out?
Yep.
I heard last week, as a matter of fact, that someone was living in it, this is in Europe, that they figured out how to get to Portugal because they had housing available for homeless. Like they are going there and I'm assuming it's like an apartment and all it has is just a little, you know, the bathroom, a bed and a kitchenette and some sort of, what kind of solutions are you thinking of? And then can I have the second part of that?
Of course.
Did you already say what percentage is Gilroy compared to everywhere else?
Yeah, so let me answer the latter first. I'll need to look at the study a little more. It's like I said, it's a lot of reading. But Gilroy typically has shown in the 15 or 16 years of the homeless census that's been conducted to be either first or second in homelessness per capita in Santa Clara County. And remember, Santa Clara County is one of the highest. I think Los Angeles and New York City are the only other communities that perhaps have more or are dealing with a higher number of individuals based on a per capita rate. So yeah, Gilroy is kind of at the forefront, and I'll probably answer a few questions that I'm going to guess you might come up with about that. But solutions, Gina, I know it sounds, I'm not trying to be insensitive, I'm not trying to be trite, I'm not trying to be anything except this. If you are homeless, how do you fix that? Give them a home. I'm not saying give them, right? We have to figure out a way how we can afford it, how we can make this managed and help sustain it, right? But the essence is, and it's been proven, right? Those that have been chronically homeless. So one of the tasks that the county has had for the last few years is anyone who's homeless, we try to assess them. We put them into a county-wide database, and based on the assessment, it's basically a number. Those that have a higher number are considered the most vulnerable. Those are the ones that are costing communities the most, right? So we've been trying to house those frequent flyers, those most disabled, those most, or I would say, those people that are scoring the highest on the assessment, get them into housing. And again, a 92% success rate of keeping those people housed. They are not falling back into the cracks. Now, of course, it's more than just housing. It's providing support services, but you're stabilizing health issues, you're increasing nutrition, you're connecting people to benefits and entitlement programs that they can have available to them, and certainly creating avenues for them to improve their health, whether it's a mental health issue and stabilizing. It's so hard if you are on medication and you are homeless. It's really, really hard to maintain your medication, right? It's really hard to wake up and take your kids to school. It's really hard to remember to get to work on time. So again, alleviating some of those crisis stressors is why that success rate is so high. But I think we have to be creative. We have to be thinking about not just building more housing. I know that's a concern for everyone, right? But we have to be creative. I know there's been talk about the county about relaxing some of the rules around in-law housing, tiny homes. Safe place parking would be a great success story for Gilroy if we could pull together enough people, whether that be the civic community, Rotary taking the lead, perhaps a congregation or some sort of religious or spiritual group taking the lead. There's been a very successful Safe Park program up in Morgan Hill that I think this community could emulate. It's just finding the will and finding the place and the passion to do that. But I think in essence, and again, I'm not trying to belittle all the efforts that's going on or the concerns we have about the cost of this, but if somebody is homeless, one of the best remedies is getting them into housing and getting them stabilized so that they can improve their lives and, believe it or not, actually not be a drain on our communities, right? So like I said, just if you're looking at the dollars, somebody who's chronically homeless and seriously disabled is costing our community about $80,000 a year. If we get them housed into some sort of permanent housing program, you know, you're talking about 25 or 30% of that. So I'm sorry, to Demornay, yes.
So with that going forward, this isn't just housing them and then that's what they do. There are going to be programs that would be set up so that they can sustain themselves down the line, right? So that they're not being taken care of the entire time. I mean, at some point, some responsibility, I think, should be taken care of getting into the programs to start learning how to maybe, you know, work at a job or volunteer or do something, give back as well, and not just living off that program forever.
Well, philosophically, I agree with you. Is that the reality that happens? I'm going to say it is not. One of the most successful programs that is being implemented is what they call Housing First. And so it's kind of that marathon story. It's a marathon with these folks. It's not a race. And so what they call it is permanent housing. So the idea is you're going to permanently house them and continue to work with them to make sure that they don't fall back into a situation of homelessness. There are many, many success stories that we have and can tell about individuals that have, you know, stabilized their lives, you know, dealt with their substance abuse issues, improved their mental health issues because they're consistently taking medication and consistently getting to their doctors or their psychiatrists or whoever, right? But the truth of the matter is, and again, I'm just being blunt, a lot of these folks are so disabled that, you know, becoming truly self-sufficient is not probably going to happen, right? Now, that doesn't mean we still shouldn't help them or we still should not look at how we can improve their lives. Because like I said, if you're looking at it purely from a financial viewpoint, the drain on our community, an economic community, which is a concern for a lot of people, is immense. But there are many, many success stories that these programs have about people improving their lives, getting jobs, volunteering, being viable contributors. And most people want to be able to do that. And a lot of them are able to achieve that. But achieving complete self-sufficiency in our community, like I said, a minimum wage job is not cutting it here. We don't pay living wages in our communities. We simply don't. That's the truth. And like I said, there's no state in the country that a minimum wage job is considered a self-sufficient wage nowadays. So a lot of the people that are on the street have very minimal education, right? They have crippling diseases. So it takes time. It is truly a marathon. And what we found, the Housing First model, is once you get them into housing, you stabilize so many of the stressors and crises in their lives that you can really start addressing some of these things so that they can, again, I think, be contributing to our community, but also simply not being that financial drain as well. Martha in the back.
So I go to Morgan Hill Bible Church.
Yep.
Morgan Hill, and we have Safe Park
Yep.
at our church. And it's been there for a year, and honestly, I've heard nothing about it in terms of problems. Like, I helped them get it started, and then I've been kind of waiting for any emergencies. We've had none. And I want to know from your perspective, what do you feel about the Safe Park programs, and do you think they're actually helping people?
I do.
Okay.
Again, it's limited. I know that particular program has limited space. But one of the biggest issues in our court systems right now is people being cited for illegal parking. There's no place for these people to go. And most of them are families. Most of them are families with children.
At our church, they only take families.
Right. So again, I think we have to address it in a dignified manner, and we have to think a little bit about where we could house this. And then again, it does come with certain parameters. And I think, like, for instance, at the Bible Church, people can be there only a certain period of time.
They're there from like 7 p.m. to 7 a.m.
Right.
They have their own showers. They brought in washing machines and dryers.
They have the trash service, et cetera, right. I think the medical van pops by is once a month or something. So there's systems that can be set up. But again, it's taking community effort, right? This isn't something that can be achieved, like I said, by saying this is St. Joseph's responsibility, or this is even just Rotary. As powerful and as strong as we are, it is really going to take a unified effort. Lots of good questions. Yes?
In your opinion, why do you think it's specifically such a problem in Gilroy out of all the cities?
So I think a couple things. One, and this report, you know, again, if you want some light reading, Gilroy actually lacks a lot of the services that most of the other communities, or I would call them what they call them jurisdictions, have throughout the county. We don't have a year-round shelter, right? We don't have a place year-round where people could go if they wanted to. Now, there is always going to be a population, there's always going to be a component of the homeless that make that a personal choice, right? They don't want services, they don't want shelter, they don't want housing, they don't, you know, that's a personal choice. That's always going to be a percentage of the people I'm speaking about, but it's very low. But to be honest, I think a couple things. I think one of the reasons it's fairly high here is it is a vast, less urban area, right? So you can kind of disappear a little bit easier here than you can in a more metropolitan or urban area. But you know why people also like Gilroy? The same reason we do. It's a great place to be. And I'm not being flip. That's what we hear. People like it here. Even if you're on the street, they love it here. I'll give you an example. We had somebody that we've been working with for a while, and they were in this database I was speaking about. Their name came up to the top. They had an opportunity to get into housing. The only problem was the housing was in San Jose. They turned it down. They did not want to go to San Jose. They wanted to stay here. They love Gilroy. But like I said, for many of the same reasons we do. They have community here, right? It's familiar to them. It's pretty. It's, you know, so I think that's part of it. Huh? And I would say, yeah, absolutely. Not perfectly safe, right? But relatively safe. So I think that's why that's kind of been some of the dynamic as far as that percentage that we're seeing down here. Mark.
Help me understand how one becomes homeless. I mean, what's the profile? What's going on there? I mean, you hear everything from vets to losing their house. I mean, what's the profile? How does one become homeless? What happens there?
Well, Mark, no one's immune to homeless. Like I said early on, it's really about 1 degree of separation. So there's lots of factors, and again, this light reading I brought can go into some of those dynamics. But it's a lot of things. It's a loss of a job. It's a family who had their rent spiked. Rent's gone crazy here. I don't know if there's any renters in the room, but you know, used to be able to rent a 1-bedroom apartment here for about $1,000. Now it's about $2,200 fair market rate. Wages haven't caught up with that, right? Cost of food's gone up, cost of insurance has gone up, cost of everything's gone up. Wages haven't met that. So, you know, you make a choice, right? And at some point in time, a lot of families, like I said, the 30% increase that this report is stating or showing, these are newly homeless, right? So there's a lot of factors, but I would say loss of a job, sometimes it's a crisis thing. I know a lot of people who've lost someone dear to them in their family, oftentimes a spouse. Perhaps that spouse was also a wage earner, but something like that, if you don't have a support system, and I think this is one of the biggest things I'll touch on, Mark. A lot of people fall into homelessness because they don't have community, because they don't have the safety net, they don't have the family members, they don't have the friends, they don't have the connectivity to prevent them from falling hard and fast. And as I said in our preventative model, getting into homelessness is a pretty quick and easy process, relatively speaking. Getting out of it, extremely hard, extremely hard. So, like I said, there are tons of variables, and if you want to read about it, but one of the highest populations that we're seeing more recently where homelessness is increasing, seniors, foster youth coming out of the foster care system. They're coming out at 18 because they're adults. They got nowhere to go. Nowhere to go. And, you know, what kind of job is an 18-year-old with, I would say, dare I say, limited education and a disruptive background? How are they going to earn a wage to pay $2,200 a month? Our government says we should pay no more than 30% of our income on housing. The families we see on a daily basis at St. Joseph's Family Center are probably spending 60 or 70% of their income just on housing. So what has to give? Easiest thing that people forego, food. Quickest, easiest thing to go out the door. So what we see in our community besides homelessness is a lot of food insecurity. Families not eating right, families not eating regularly, families certainly not eating nutritiously, right? The most filling food, starch. It's accessible, it's cheap, and it fills you up. Is it good for you? Absolutely not. Not every meal, right? So food insecurity is rampant in our county. Again, it's embarrassing. It's over 30%. 30% of our of the people living in Santa Clara County cannot put food on the table on a regular basis. We got to do something about it.
And the other one that we see a lot in our plans is divorce. That when a divorce happens and both people are earning an income, then there's nowhere, so the mom takes the kids and they have nowhere to go.
Self-imposed, just making poor decisions or choosing that lifestyle. There is a group of that. I'm not denying it. But a lot of people get into a spiral downward that they can't get out of, and most of the reasons why they can't get out of it, you guys, is they don't have family. They don't have support. They don't have a safety net. They don't know where to go. And it spirals down really fast, and then they start to drown. Once you get out on the street, one of the best ways to cope with that, you start drinking. You start using, right? So you start to make poor decisions based on that downward spiral, right? And then it becomes much more complicated. So anyway, more questions?
We have time for one more.
Okay. And you guys, again, I'm not a bleeding heart liberal, but what I truly believe is this is something we can solve. This is something where Rotarians, the city of Gilroy, and our community can make an impact if we decide to do it and decide to coalesce all the players necessary to make it happen. We simply have to have the will. One more question. Two more.
I just had a comment there.
Yes, sir.
If we could build an animal shelter, we should be able to build a homeless shelter.
Yeah.
Hey, I agree with that.
Martha, can I share a quick one? Sure. No, I'll share it with you later. But I just had it. So no, never mind. It was. I thought it was going to be funny, and then I realized it wasn't. So I'm going to just keep my mouth shut.
So I just wanted to remind you, we're going to have a follow-up forum. Remember the forum that we?
Yes.
And it's going to be on Monday, October 28th at the library.
Yeah.
And if you want to tell them so
Well,
that.
and you guys, part of it is, again, communities being housing ready. We, as voters, passed a bond a couple years back, almost channeling $1 billion for housing opportunities, not specifically for homeless. A lot of that is for the homeless, but it's also for first-time home buyers. It's for a lot of different, people. I think they've probably got about 50 projects in the works. There's not many coming down here because we're not supporting it. We don't want it. We are ignoring it, or we are in denial. Again, I'm just saying that there are opportunities for us to do something. And I think that's, again, going to take the community effort. It's not going to be one group or one constituency. It's going to take the entire community to decide, if this is something that we want. And you guys, let me reiterate. A lot of our exposure to the homeless are the people that we encounter on the street. And again, maybe not the best representation of people that are homeless. But we are talking about our neighbors. We're talking about families. Like I said, that 30% increase are new homeless. And unless we stop that bleeding, that number is going to increase. Now, again, I don't have a recipe. I don't have a plan myself, but I want to be part of it, right? But that number is going to continue to increase unless we figure out how we can stem the flow, put more money and more effort into prevention, and then create systems where we can, again, have a longer impact. Yes?
How do we stay involved with being in the know, and is there a committee, is there a nonprofit, is there somewhere where we can, because it feels very spread and it feels very big, but
Yep.
we do need to all get involved. So
Right.
is there resources besides the ad or whatever?
So there's certainly a couple of agencies that you could connect to, but also I would say go to the Destination Home website, and they are very strong proponents, not about services for the homeless, but about impacting the housing crisis that we're in. So I would say that's a great place to start. I know the city of Gilroy is in the process of creating a consolidated plan for the next 5 years. That might be a good place to have your voice, and again, I'm sure there's going to be public announcements about that. But again, that's where people can be heard. Where do we want the city of Gilroy to prioritize? And I find what's interesting, you guys, if you look at the consolidated plans over the last 10 years for the city of Gilroy, if you look at the top 5, affordable housing, services for the homeless. This is the city of Gilroy stating these as priorities, right? Right? So, I mean, that's us. That's our constituency that is telling the city of Gilroy, we believe these are the priorities that we need to address. So I certainly would like to see those continue to be priorities, but also be more proactive and more aggressive on how can we really make it. You guys, here's the thing too. Some of these housing projects that we're seeing, now we're not seeing a lot of new ones in South County lately, but when you see a development come out and it's, you know, being released out into the community, they call it affordable housing, but a lot of times it's not truly affordable, right? Because there's different categories. There's different ranges of low income status. So if you fit in the upper echelon or the top percentage of being low income, that's where those houses are being built for. Not the very low income, not the extremely low income, right? So whenever somebody says affordable housing, my first question is, are you talking truly affordable? Because $2,200 a month, that's Gilroy rates, right? If you go up to Cupertino, $2,800, $3,000 for a one-bedroom apartment, and I'm not talking a good apartment, I'm not talking about a great apartment, I'm not talking about an apartment in a good area. That's $3,000 for a dump. But I think part of it is, sorry, I lost my train of thought. But that's where I think we have to think, you know, that's where we have to make the change. We have to balance things out. There's just too much of an imbalance here economically, and it's suffocating and drowning our neighbors and our friends. And that number just keeps getting bigger.
All right. Okay. Thank you.
Yep. Thank you very much.
Thank you.
Now you guys can get all your good speakers in. Pass that list around.
No, that was awesome. Thank you very much, David. Really appreciate the insight and the introspection on our housing situation here.
I'm going to lead this light reading for you guys. It is actually kind of interesting. And actually, these studies have like summary pages. So you don't have to read all 80 pages. You can just read the executive summary just to get a feel for what we're looking at. It really is a crisis. You guys, we can't brush it off. We can't ignore it. It is a crisis. And it's a crisis that's getting worse each and every day. And if you don't believe me, like I said, all you have to do is open up your Facebook, open up your paper, turn on the news. You know, so when are we going to make a stand? When are we going to say enough is enough?
Great. Thank you again. So yes, we have material on up front here. As David mentioned, please pick up a directory. And don't forget our charter night and housekeeping item. If you have a business card, there's a drawing. Mine's the only one in there right now, so hey, I'm going to win. All right, so that being said, I want to thank Chuck for coming this evening.
Thank you.
James from traveling all the way to England just to visit us. And support our local businesses, Gina Lopez State Farm Agency, for sponsoring this evening. With that, if I had a bell, I'd ring it. That's a wrap. Thank you, everyone. We'll see you next month.
How are we doing with the form? Oh, have you seen the form yet?
So who is that? Yes, it did.
Did you see the program form? Did the program form?
Oh, good.